Today I'm going to be diving into a really important and often confusing topic, off-label medications for tinnitus. In other words, medications that doctors sometimes prescribe to help with tinnitus symptoms, even though they're not officially medications to treat tinnitus. We'll go through what these medications and what the research says and the pros and cons of trying them. So just stick around until the end because I'll also share some safer non-medication treatments that tinnitus experts recommend. I'm Dr. Michelle Neidleman-Kennedy, an audiologist who previously worked at NYU Medical Center in New York City, working with individuals with hearing and balance disorders. My professional focus is now working with individuals who have tinnitus, and since I started working at Treble Health in 2021, I've helped over 500 patients. So we're going to start off with what off-label means. What do we mean by that term? Well, in the US, the FDA approves medications for specific conditions. For example, a drug might be officially approved for depression or epilepsy, but sometimes doctors will prescribe those medications for a different reason, like tinnitus, even though that it hasn't been formally tested or approved for that use. That's what off-label prescribing is. It's not illegal and it's actually very common in medicine, but because the medication wasn't designed or proven for tinnitus, the results can be very mixed and varied, and the risks may outweigh the benefits. So that's why it's important to understand the details before considering any of these options. So we're going to start off by discussing antidepressants. This is the most common off-label used medication for tinnitus. And tricyclic antidepressants like amitriptyline and nortriptyline are often prescribed. Some small studies have found that they can reduce the distress caused by tinnitus, especially in people who struggle with depression or anxiety. But they don't seem to consistently reduce the actual loudness or ringing itself. Then there's some newer antidepressants like SSRIs and SNRIs. Some of the more commonly ones prescribed are sertraline, paroxetine, or venlafaxine, and these are some medications that have been prescribed to help with the depression and anxiety, which are a big part of many individuals' tinnitus journey. The evidence says that they may mainly help with mood and not the tinnitus signal itself. One of the best known studies is a 12-week double-blind randomized trial of nortriptyline in people with severe chronic tinnitus. The study actually found improvements in tinnitus-related disability and depression, but not a consistent drop in the actual loudness of the sound. In other words, some people cope better even if the noise itself isn't actually turned down. Unfortunately, there are some downsides or some side effects from the medications. Tricyclics can cause dry mouth, dizziness, in some individuals even heart rhythm changes. SSRIs and SNRIs can also cause things like nausea, sexual side effects, or sleep problems. So the bottom line is that while antidepressants may help if your tinnitus is made worse by things like depression or anxiety, but they're definitely not a cure for tinnitus itself. And I personally have worked with many individuals who have taken these medications with varied results. And I can recall one specific individual who started nortriptyline mainly for sleep and low mood tied to tinnitus. After a few weeks, he actually reported feeling much better. He was able to sleep better. He started to feel less panic about the ringing in his ears. But he also noticed that he was having some daytime grogginess, and he decided that the trade-off was worth it, while he was also learning cognitive behavioral techniques and skills to help manage the tinnitus. And then in time, he started to actually taper off the medication. And I want to share that we worked with some of the top tinnitus doctors and created a free online assessment where you're asked 10 questions. And based on your answers that you provide, a detailed next step for your tinnitus treatment is given. And it's called the Tinnitus Quiz. So to try it out, you can actually just click the link on the screen or go to tinnitusquiz.com. Next up, we have benzodiazepines like clonazepam or alprazolam, and some small studies have actually suggested that these can temporarily reduce how much people notice their tinnitus, and they can calm the anxiety that often comes with it. But here's the catch. Benzos, as they're more commonly known, can be habit forming, and you can start to develop a tolerance, a dependence, and if you start to get off of them, they may also produce withdrawal symptoms. So even while you're taking them, they can cause some drowsiness and memory issues. Because of the risks, most doctors will only consider them as a last resort or a short-term option for people who are really struggling. One specific individual was prescribed clonazepam during a severe spike, and she actually felt noticeable relief during the first week. She was sleeping better, her fear response had actually dialed down, and by week 3, she noticed a diminishing effect and didn't want to increase the dose. So with her physician, she actually started to taper off of it and shifted more to cognitive behavioral techniques and sound therapy to help maintain the progress without the use of medication. Another group of medications that have been tried as off-label tinnitus medications are anticonvulsants. So some of the common ones are gabapentin and carbamazepine. Gabapentin is often used for nerve pain, and some researchers have thought that this could also help with tinnitus, since the condition is linked to overactive nerve signals. There was one large 8-week randomized clinical trial that found no benefit over the placebo for subjective idiopathic tinnitus. Smaller trials have been mixed, but the best data say that it's just not a consistent help. Carbamazepine is interesting because it is often found to help with a very rare type of tinnitus called typewriter tinnitus. That's when the sound is more like a clicking or a popping, and it can often be caused by nerve compression. So outside of that, it's not really helpful for most tinnitus sufferers. There are also some medications that target brain receptors linked to sound perception. Memantine is usually prescribed for Alzheimer's disease, but it has been studied in tinnitus. Unfortunately, the results haven't been very convincing, and there's another drug called AM101, which is an experimental gel injected into the ear, which was tested in clinical trials for acute tinnitus after noise exposure. Early results looked hopeful, but later studies didn't show enough benefit for approval. And then there also are steroids, which are often prescribed when tinnitus is brought on quite suddenly and may also be accompanied by symptoms of hearing loss. So sudden hearing loss, sudden onset of tinnitus, and as well as sudden onset of dizziness or imbalance. In those cases, steroids may help with the hearing recovery, which can in turn help reduce tinnitus. But for chronic long-term tinnitus, steroids don't seem to help. And you may have also heard other things like beta blockers, zinc, or ginkgo biloba supplements. Unfortunately, the evidence just really isn't there. Some people swear by them, but the larger studies that have been conducted don't really support their routine use. So let's now review what the guidelines say and what some of the experts say. The American Academy of Otolaryngology has published guidelines on tinnitus, and their message is clear that medication should not be the first line of treatment. There's just not enough evidence that they reliably help. Instead, they recommend focusing on some proven strategies like cognitive behavioral therapy, sound therapy, and hearing aids for people who also have hearing loss. Medications can still play a role, but mainly for treating some of the symptoms that are also associated with tinnitus, like depression, anxiety, or insomnia. But they shouldn't be seen as a direct fix for the ringing. I don't want this to feel discouraging, so let me share the good news. In the meantime, there are treatments that really do help people live better lives with their tinnitus. Cognitive behavioral therapy, or CBT, is the most strongly supported one, and there is extensive research that has found that while it doesn't eliminate tinnitus, it can change how your brain reacts to it. It can help you feel a reduction in the amount of distress or overall impact that it's having on your life. Hearing aids have also been found to be helpful. So there are a lot of hearing aids that also offer tinnitus features and functions, and they can help if you also have hearing loss. A lot of these devices now have built-in sound therapy that can help manage your tinnitus. And then there are emerging treatments like Linear, the FDA-approved bimodal stimulation device, and we're still waiting on Dr. Susan Shore's device that's currently moving forward through the approval process. So again, there are a lot of exciting developments that are finally there to give people new hope about treating their tinnitus. So to wrap up, yes, doctors sometimes will use medications off-label for treating tinnitus, But the benefits are usually modest and variable, and the side effects can be significant. However, sometimes the reason that tinnitus is problematic for an individual can actually be treated through the use of some of these medications, like antidepressants, which can allow an individual to change the way that they are reacting and responding to their tinnitus. This can then lead them to habituate. It still appears that the best approach is a holistic one, and that's something that we also really believe here at Treble Health. So managing tinnitus with things like therapy, sound therapy, lifestyle strategies, and using medication mainly to support mood or sleep if needed can be really beneficial. So if you have found this video helpful, please give a thumbs up and consider subscribing for more evidence-based updates on tinnitus treatments. And remember, you're not alone. Millions of people are walking this path alongside you, and the research is moving forward each and every year. So again, thank you so much for watching. And if you have had any experience with some off-label medication use, please comment below. Thank you.